Okay, thank you everybody for coming to our weekly press conference that we have to kind of update the public, the general public, what we are doing within the Clark County Valley to move our valley and our state forward. So first and foremost, I want to start by thanking the multi-agency command center that meets on a regular basis. We meet on Mondays and we go through and figure out where are we as a community and what things and what priorities do we continue to work on. I want to thank Ms. Valentine for coming today and showing the support of some of the things that we talked about yesterday. Today, what we're talking about is where do we go and how do we prepare for our future. And we know that our future will not be normal as we seen back in January, but how do we plan and what are we doing as a county getting ready for that? So today, we're going to talk a little bit about business licensing across jurisdictions. Everybody is looking at their business licensings. We want to ensure that when we get the go-ahead from the governor's office, that we can help business navigate to the new normal and get up and going. So today at our Board of County Commissions, we had a very robust conversation where we gave direction to our staff to be friendly, flexible, and fluid so that we can ensure that business can get going. So that's good conversations. Other jurisdictions across the valley are having those same conversations so that everybody is ready to go. Today, you're also going to hear from Councilman Black, who is the chair of the Health District, who will talk about the efforts that the Health District is doing because we have so many food establishments across our valley, things that we're putting in place to ensure that every agency is working together to streamline this process when we get to reopen based on the governor's direction. Secondly, we're going to talk about testing. Testing has been a key component that we've seen across the nation on how do we move forward, how do we get back up and running. And so the testing that you're going to hear today is phenomenal. We've been working for a very long time since the very beginning. We've been running 2 tracks on what does it take to get us back going and how do we address the immediate priorities of the day. So you will hear a very in-depth presentation on testing. There will be lots of questions, but know that we'll have a second piece where we can follow up on that because before we roll anything out, we want the general public to have a good idea of how to make it work. You're going to hear from Commissioner Weekly, who is the chair of UMC, on the what this does for UMC as a whole when it comes to research, when it comes to moving UMC with our UNLV Medical School forward for the long term, because this is something short term that we're talking about for testing, but we're talking light years away what this can do for our community. So then you'll hear from Mason Van Hollings, did I get that right? To talk about the in-depth piece on testing. And then, of course, Dr. Lagon, who has done yeoman's work at the Southern Nevada Health District on where we are today, what are we seeing, so with all of that information, we hope to give the general public some up-to-date information. We think by doing these at least weekly, we're telling people exactly what's going on and in layman's terms so that they can understand it, because everybody is anxious. We encourage you to be patient. We encourage you to still use social distancing. We've seen all of that make a difference. But going forward, what is the new normal for our valley? What is the new normal for our state? And how will we bring the economy back? So with that, I'm going to turn it over to Commissioner Weekly, who is the chair of UMC, to kind of give you some inspiring words.
Okay, can I take this off? Yeah, spray me. Yeah, spray me up. Yeah.
Sorry, you're
All
sprayed.
right, there you go. All right, I'll take one of those. Good afternoon, everyone. First of all, I'd like to thank our chair of the Board of County Commissioners for this press conference here. We think it's so vitally important that we continue to communicate with our public and to keep our constituents informed of what's going on. Each of us here, as the chairwoman stated here, we had a very robust meeting here today. We're all receiving hundreds of calls from folks that we represent wanting to know what's going on as it relates to UMC, what's happening with the possible reopening here in Clark County, what's going on from a business licensing and liquor and gaming standpoint, what's going on with our tourist community. Lots of questions are being asked, and thank you again to our chair, our county manager, Yolanda King. So vitally important. You know, I recall something that was said to me as a kid. A setback is nothing but a setup for a comeback. And I believe that when we all work together and we all pull our resources together and we all stop working in silos, we can make this happen. And so looking at UMC, the partnership that we have with UNLV in terms of building our schools, nothing has changed. It's just we are at a standstill right now. And we do strongly believe that this project will move forward, that this relationship and partnership that we have with UNLV and the School of Medicine will be much stronger. But when we look at what's happening today in the immediate, I'm so very happy to have our CEO here from UMC, Mason Van Hallen, to give us an update and give us a report on what's happening with testing. That's so vitally important. And as we continue to watch the media and we see the numbers, the number of confirmed cases, we see the number of confirmed deaths, there are a lot of people out there extremely concerned. And so we're here today to provide as much information as we possibly can. And so with that, I'd love to introduce our CEO of UMC, Mason Van Hallen. Thank you.
Thank you, Commissioner Weekly, to you, the trustees, and our governing board for not only supporting us through this time, but all the many, many years of UMC in operation. So what we want to do today is kind of lay out what's changed from last week when we spoke to you. There's a lot of good news that I think you're going to see in some of my report today, and it's all moving in the right direction. First of all, I want to just cover some of the statistics here, particularly in Southern Nevada and Clark County, and take you through where we're at as far as our resources, our beds, our ventilators, and our staffing. A little bit about our hospital beds. We have 4,499 acute care beds here in Clark County. That represents about 20 hospitals, all the way to Mesquite, to Boulder, and all the hospitals here within Clark County and Las Vegas. Just a little bit about the beds that are currently occupied. We have about 65% of those 4,499 beds that are currently occupied, which means also that we have 35% available. A lot is talked about our ICU beds, our intensive care units. We currently have 612 ICU beds. Many of those ICU rooms have been converted into negative air pressure flow to be able to help contain the virus within these containment units of our hospitals. Of those ICU beds, about 76% are occupied, or 24% available. And of those 76%, 24% are occupied by COVID positive patients, or about 147 patients. We've done a lot of work related to our ventilators, managing our ventilators, acquiring ventilators for Southern Nevada. We've got 679 ventilators in use or available at all of our hospitals in Clark County. Only about 40% of those are currently occupied, which is a good news story, and this continues to tick down day after day, week after week. But of that 40%, about 41% are occupied by COVID positive patients. So about 111 are COVID positive patients on ventilators as we speak today. Our staffing level, our doctors, our nurses, our technicians, we're all in the green. Every hospital, we have available staff. And a lot about our personal protective equipment, and through the generous donations of the community, all the local businesses, we've been able to be consistently in the yellow, and I would say this is a very bright yellow. This means we're 7 to 14 days on hand, and we've done a very good job of acquiring, sourcing, and making sure that all of our healthcare workers have the PPE that they need to do their jobs. Just a little bit about the demographics. We've tested close to 30,000 individuals in the state of Nevada. Good news is 12% of those are positive patients. So we've got a lot of negatives that are out there. So we're doing really well in our social distancing. Some of the age demographics, as you can see on the screen, the average age is about 52 years old. And from a gender standpoint, it's about 51% women and 49% men. So it's essentially equal balance there on the gender. Just want to talk a little bit about some of the treatments that we've been doing in the hospitals. But clearly our best weapon against this virus has been social distancing. It's been very effective, but you see and you hear, you read a lot about things on the TV about what's being done in our treatment areas. So some of the available treatments that we're doing here in Southern Nevada is the hydroxychloroquine. You hear a lot about that. We are treating patients that have been hospitalized with this drug. Darnavir is another drug, antiviral drugs that we're seeing in our hospitals that is being used. Remdesivir is another drug that we are treating patients, another antiviral drug that's being dispensed within our hospitals here in Clark County. And a lot of biologic treatments to prevent the body from being overwhelmed from inflammatory disease, a response in the body, and we found this very effective in our hospitals. And just some of the therapies that we're doing in Clark County hospitals, and some of these that we learned from best practices, in particular from the state of Washington, that's been published along the way. But we've got a lot of clinical care, treatment pathways, early intubation, early traching, continuous renal replacement therapy, or CRRT. And then we've also been proning patients, and I talked about this previously, about how we're turning patients on their stomach, putting them in a swimmer pose, turning their heads to the side and using high flow cannulas to infuse oxygen to be able to keep patients off ventilators. And so we're not using mechanical devices to help patients breathe. And then one of the things that I'm excited to talk about over the next 7 to 14 days is you've heard about convalescent plasma therapy. And this is where we're able to take patients that have been tested positive, that have overcome the virus, and they're able to donate their blood. We're able to spin that blood and take the plasma from the blood, package it, and be able to infuse that into critical patients in intensive care units to help with fighting off the virus. And we're hoping to do that within the next 7 to 14 days, but we're working with our blood companies here locally to be able to do that treatment. And for every one patient that we're able to find a donor for plasma therapy, it's able to help treat 3 critical care patients in the hospital. So you'll hearing more about that as the days come. Just about our surge plan. Last week we talked about our surge plan, and thanks to Chief Steinbeck for all your hard work and leadership and making sure that we have enough beds should we see a surge and an overflow of all of our hospitals here in Clark County. But I do want to just start by the acute care hospitals. Every hospital has a surge plan that we're able to expand up at a minimum of 120%. Some hospitals go beyond that. But every hospital that I talked about earlier, we currently have great capacity. But if we do get into a surge, we're able to expand another 871 beds within the 4 walls of the hospitals. We're able to do that in really atypical areas. We're using our pre-ops, our PACUs, outpatient treatment areas. Many hospitals have even put up medical tents outside their facilities. Next is the Cashman Care Center. This is an isolation center. It's been up and running for about a week now, and we've done a great job. The city's done a great job of managing that facility, and it's a game changer for us. Currently, there's about 300 beds that they can ramp up to. Their census right now is about 30 patients, but we anticipate that that will increase. But an important asset in the surge plan and our alternative care sites. The Southern Nevada Health District is here, and Dr. Legan and his team is putting up a 45-bed isolation center over at the Decatur Health District location. And then all of our partners, our LTACs, our long-term acute care facilities, our skilled nursing facilities, have surge plans, and we've been able to use some of those beds to be able to treat some of our patients in our community. And then lastly, we talked about the Las Vegas Convention Center and the ability to logistically and prepare to ramp up to 900 beds there. And again, thanks to Chief Steinbeck and his team for us to have that asset available. Okay, as you heard earlier on, and all the reasons why we're up here today and working very hard to reopen our community. And one of those requirements is the availability of widespread testing. It is our #1 priority to be able to test in our community. So I just wanted to take you through and our community through what the testing looks like here in Southern Nevada. Currently, the Nevada State Health Lab has a 400 test capacity per day. The Southern Nevada Health District currently is doing 200 tests today, and then over the next week, Dr. Legan and his team is ramping up to do another 200 on top of that, so a total of 400 testing capacity. And then University Medical Center, we are basically set up a secondary lab, and we're able to test about 500 tests on a daily basis. All these three components together, all done here in the state of Nevada, can turn around tests anywhere from 8 to 24 hours turnaround. And I don't want to leave out our private partners, Quest, LabCorp, UNLV has done a great job working with CPL. These are all average tests per day, but they have a lot more capacity. These test turnaround times are about 3 days, but your doctor's offices, your quick cares, all have the ability to order tests from these private companies to be able to bring more testing and wide capability to Southern Nevada. So also I want to talk a little bit more about some of the things that we're working on at UMC and some of the timelines to be able to ramp up more additional testing in our community. We've essentially built a second lab at UMC that's dedicated to COVID lab testing. By the end of the week, April 25th, which is this Friday, we'll be able to test up to 1,500 tests per day at UMC. By May 1st, that's going to ramp up significantly to 4,000 tests per day. In between May 1st and June 1st, we're launching the antibody testing, and that's what I talked about earlier, where perhaps a patient or an individual has been exposed, perhaps wasn't symptomatic, but has built antibodies. And so we want to be able to test that population to see if there's immunity and built up antibodies to be able to identify those patients or those individuals. And then on June 1st, we should have a testing capability of 10,000 tests per day. All the swab collections, and we're going to be working very hard over the next week to be able to locate and identify community partners to be able to do collections. And you'll hear a little bit more about that from Dr. Legan, and we'll be working very closely with him and Chief Steinbeck and the MAC to be able to do that. So again, very positive news. The antibody test is a serological test, so it is a blood test. And so we're looking to be able to do that very shortly. Just a reminder to the public, all these tests, whether you're on Medicare, Medicaid, or private insurance, should be covered by your health insurance, so don't be afraid when we get this fully up and running, or even using our private companies, that you do have access to those LabCorp, Quest, in any hospital. We will do the test, and it should be covered by your insurance. Next, I just want to take a moment to talk about servenv.org. We've had about 1,000 volunteers volunteer for servenv.org, but if you're interested in volunteering and helping out, especially if you're a healthcare provider, we're definitely interested in hearing from you. You heard a little bit about blood and plasma earlier today. I will tell you our blood supply is low because of donations have been down. But Vitalant and Red Cross stand ready to be able to accept blood donations. Please go to their websites and see if you are able to donate during this time. We do need blood to be able to support the hospitals and surgeries that need to be done in our community. And then I do want to do a plug for Nevada Health Link. If you are going through some difficult times, especially during this difficult economic crisis that we're experiencing and concerned about healthcare coverage, Nevada Health Link has opened up and extended their open enrollment until May 15th. So there's certainly options for insurance, but we'd love to have you go out and check that out as well. And then lastly, I just want to say thank you to our community. It's on the behalf of all the hospitals and the healthcare providers, the doctors, physicians, therapists, all the technicians, all those that work at the bedside, all those that support at the bedside, thank you. Thank you to all the large companies and all the hometown Nevada companies here that have donated their PPE, their supplies, their disinfectants, and help feed hospital staff. Thank you to all the hotels and resorts and casinos. Virginia, thank you so much for your leadership, and the resorts for leveraging their resources and supporting our healthcare workers. You've always been there for us, so we truly appreciate that. And then thank you to every person who's donated in every way to healthcare in our community. Thank you for those that have stayed home, that stayed healthy, that allowed us to do what we do best, and that's taking care of you, our friends, our neighbors, our colleagues. So again, we are truly stronger together, and I appreciate the time to talk to you today. Next, I'm going to turn it over to Mr. Scott Black, who's the chair of the Southern Nevada Health District, to talk a little bit about what the Health District is doing. Mr. Black?
Good afternoon, ladies and gentlemen. I appreciate the opportunity to be here and speak for a few minutes. Before I introduce Dr. Leguen, our Acting Chief Health Officer at the Southern Nevada Health District, I just wanted to make a few brief points about some of the work that is being done at the Health District. The Health District, as you know, has a primary focus and charge to provide sound public health for our community. And we do that every day of every week of every year, regardless of what is going on in our community. And we have an amazing team of capable folks at the Health District that are committed to the public health of Clark County. So when you add on a layer of uniqueness such as the coronavirus pandemic, we already have a system that we can be confident in that deploys to try to maintain the public health aspects of our community. And that's exactly what the folks at the Health District have been able to do. Our health District team with our epidemiologists, our contact tracing, all the efforts that are being done to stop the spread has been effective, and they've been able to take our core programs that we have in place and scale them up to a point to be able to address the added demand that this pandemic and its uniqueness has brought to our community. So I just wanted to say thank you to the Health District team. None of the folks there, from Dr. Leguen all the way down across all levels of the staff, do what they do for accolades or public recognition. They work largely behind the scenes, but I wanted to take a moment to say thank you to them for their dedication to public health. Commissioner Kirkpatrick, Chairwoman Kirkpatrick mentioned a two-track system. And the Health District is engaged in that two-track system as well as we address the issues in front of us with the contact tracing, with testing, with reporting, and making sure that people that need tests get tests, and dealing with the frontline aspects of preventing the spread. We too are also focusing on a future day, hopefully in the not too distant future, of what it will look like when our community resumes a level of normalcy. And our experts at the Health District, our emergency management team, with all the medical experts within the organization, are developing a plan, a blueprint that will, in fact, help us open up as a community. I believe that we have one opportunity to do it and to do it right, and I know that the plan is being developed to do it right. And what I would implore those of you that are listening is that it's going to be a partnership effort. A plan is only as good as its implementation and execution, and that requires everyone to learn about the plan, articulate what the plan is, and then execute the plan and do your part. That's business owners, that's residents, that's visitors that will inevitably come back to our community again. We all need to do our part to make sure that this plan is effective for us to reopen and do so in the right manner. I'd like to introduce Dr. Leguen. Dr. Fermin Leguen is our Acting Chief Health Officer. Dr. Leguen took the lead at the Health District early last fall, and he didn't see this coming. He's done a tremendous job. He's a stable leader, and that's absolutely what we have needed, and what I, as the board chair, and I know many of the board members appreciate about Dr. Leguen is his steadiness and his leadership during this difficult time. So I'd like to introduce Dr. Fermin Leguen.
Okay. Thank you, Chairman. Good afternoon. Well, I'm going to talk a little bit about the Health District and what we are doing with our partners in the community. First, I'm going to mention the number of cases that we have and the mortality. Until today, we have a total of 3,099 confirmed cases of coronavirus in Clark County. We also have 141 deaths related to coronavirus, and we estimate a total of 1,841 cases who have recovered from this condition. I also want to express our condolences to all the families who have lost a member, and also those who have lost a loved one. Also regarding community trends, and this is something that we have been listening through the news, almost every day in recent days, mentioning declining on the number of cases in the community in other areas of the country. I want to say that in Clark County, it seems to be a plateau now in the number of confirmed cases that have been reported. We have noticed also a decrease in the numbers of deaths reported, but I also want to say that these are very recent numbers, and still we haven't seen a consistent decline in the number of cases or deaths in the community. But it's something that we have to keep an eye on that. I also want to mention that the reason that right now we are experiencing this plateau in the number of cases in the community seems to be directly related to the social distance measures that have been implemented across the state and Clark County, and also the issue of the restrictions in commerce and facilities that have been closed or limited services during this period. That has helped decrease dramatically the number of people who are actually in our streets, and also decrease the possibility or probability of people being infected through the spread of this virus. I also want to mention regarding testing, Mason already gave a really good picture of where we are today and which direction we are going. We recently received 8 machines, rapid testing machine, about rapid testing machines from the state that we are now in the process of distributing some of them. Actually, we are sending 4 of those machines to community health centers here in Clark County, and also we are keeping 3 of those machines at Health District, which we will utilize in some of our community interventions, also outbreak investigations and work that we're doing with the senior facilities. Something very important regarding testing is that we have seen how at-risk communities and also minorities have been disproportionately affected by this outbreak. So it's something that we want to address immediately with the testing is not just expanding the testing across the county, but also making sure that we are making testing accessible to communities who are at risk, and also communities who are in a disadvantage. We recently met with North Las Vegas, City of North Las Vegas. Actually, last night we have a meeting with them, and we are planning to start a testing site in North Las Vegas sometime by the end of this week. By doing that, we want to make sure that that testing is available to residents of the area that we discussed with the city. But as importantly, we want to make sure that that testing is available for the African American community in North Las Vegas, who have been very affected by this condition, and at a level higher than other ethnic or racial groups. I also want to say that Our public health lab has increased its capacity, as was mentioned before. We are now doing about 200 tests a day. Next week, we should be at 400. And probably within the next 2-3 weeks, we are expecting a new machine that would allow us to incorporate antibody testing into our system, and that machine will be able to offer somewhere between 300 and 500 tests, additional tests a day. And then just before leaving, I just want to reiterate what we have been discussing every week, every day with our community, our partners, and it's the issue of keeping social distancing as a critical element of our prevention, and also making sure that we follow the hygiene preventive measures that have been discussed before, such as using a mask, whether it is a clothing mask done at home, also making sure that we wash our hands anytime that we are in and out of our home or our office, or we are in public places. When we go to the supermarket and those public places, make sure that we try to keep the distance with from other customers. And more important, if we develop any kind of respiratory sign or symptoms, please stay home. Don't just go to your doctor. Before going to your doctor, please call their office and tell them why you are planning to go, and then the most likely scenario is that they will give you recommendation on what you need to do, and you don't actually will have to go there. And I will stop here, and Commission.
Okay, thank you. And I want to go back a little bit. Mason, if you could pull up that slide that shows what we're going to be doing for the long term. So we as a community are unique, other than any other communities across the country. One, we rely on 52 million people to come to our valley to create jobs, to pay sales tax, to invest in our community, to have entertainment, all of those things. So we have that component that many other states across the country do not have. But secondly, and most importantly, is we have about 3.1 residents that live here that are essential to making our community vibrant. So when we talk about what is it going to take to get us back on track, what is it going to take to open our doors, what is it going to take to have a new normal, those numbers are super important, because if you look across the country, they're saying we can do 2,000 tests a day. We're talking, we want to be able to do 10,000 tests a day in less than 1 month. We also want to be able to do the antibody, and that is not possible for a lot of communities. And the reason why it's important and possible here is because of our partnership with the health district, our partnership with the other hospitals, and our partnership with our medical school. So we are fortunate to have all of those common denominators to help us have some long term. We know that people want to be tested. I get at least 10 phone calls a day. How do I get tested? Where do I get tested? Well, we want to roll out something so that everybody that feels that they want to get tested can get tested. So Chief Steinbach, over the next few days, is going to do what he does best, is he thinks about every nook and cranny. Did we miss anything? How do we get it out? Did we solve the solution? And so as we roll this out, we need you, the media, to help us help residents be able to get this testing. One, if they're sick. Two, if it gives them a little bit of self-relief. But three, opening our community. So before we can have any large events in our community, we have to have the ability to test in the event that we need to. Again, we need to roll this out slowly, methodically, because nobody wants to open all the doors tomorrow and then have to turn around and close them in 30 days. That is not what we want to do. So patience is important. Following and tracking folks that test, and remember that when the testing numbers, when we start testing more, as we all think back to late February when there was 5, and then we tested more, we watched the numbers grow. So as we go through this, we're going to see the numbers grow, and we may see some positives grow, and we may see some antibody components grow where people have had it but didn't really experience any symptoms. But we'll be able to track all of that for the long term and to research it. So it doesn't stop just when we get back on track, when we don't have to have social distancing. It doesn't stop, because we will still harp on everybody to use good hygiene, to wash your hands all the time, to make sure that you're keeping your distance from people when they're sick, and when you're sick, stay home. So what we're telling you today is we have been working for a very long time to ensure that testing will matter for our residents, testing will matter for our tourists as they come back. And so I hope that you guys will help me help educate folks that when we roll this out, and you see that as of Friday, we'll be able to do more. And it's with our partnership with the health district that we will able to do this. And it's all Nevada-grown business. So I want to remind people that this is Nevadans that are participating in this, Nevadans that are testing, Nevada medical workers that are actually reading the test, Nevada workers that will be following up with folks. So that is a unique piece of what we can always do to make our community better. So lastly, what I would say is, as we roll out the business component so that we can ensure that people can start planning and that they can have the resources that they need to get open. The health district has been working for probably about 5 weeks now on a sheet where we'll allow people to help self-certify themselves, and we'll come back out to inspect them. But we don't want to hold anybody up longer than we have to get started. So every week I always say, what can you do to help me? So first and foremost, I ask that all businesses reach out to their electeds and let them know what you think that you may need when the governor gives the date to open. It'll be important for us to hear from all walks of business, whether you're a business of 2 people or a business of 10,000 people. We want to know what you need so that as we're moving forward, that we can ensure that that gets covered. 2, I ask that you continue to be patient, that you continue, we want to do this methodically, and we want to ensure that we only have to do it once. We are working with the state. We have supported our governor 100% to ensure, and it is our responsibility as the Clark County Commission to open the Las Vegas Strip and to ensure that we do that right. So we are not in a hurry. I don't believe that businesses are in a hurry to just open up and have to go backwards. So if you're a business, please reach out to your electeds, your county commissioners, let them know what you may need. As residents continue to practice social distancing, we've done yeoman's work as a community. We're at the top when that happens. And we need you just to be patient a little while longer, because we're going to do this together, and we're going to ensure public safety is important. We're going to ensure that our employees feel comfortable going to work each and every single day, and we're going to rebound together. That's what we do. I think Commissioner Weekly had the best quote, and I'm going to have to write it down so I could put it in my pocket for the future. But I want to take a moment and thank all of everybody who's pitched in and done their part. And some people have done the smallest piece, but some people have done the biggest piece. But that's the community that I grew up in. That's the community that I love. And that's the community that I want to stay with. And lastly, for all of those essential employees out there that have showed up every single day, that have had to be there to wear their masks, we We thank you across Clark County for all that you have done to ensure that. So with that, we'll turn it over to questions, and I know most of them are for Mason, so I'll bring him up first.
Hi. Sure, and I think it's going to probably take the three of us to answer that question. But just from my perspective, obviously, when we do more tests. Oh, I'm sorry. Let me repeat the question. Make sure I get it right. As we test, as we do more widespread or increase our catchment area, the concern would be of seeing more positives or throughout the community. And then the second part of the question was, what are some of the indicators that we would look at as far as our guidance on reopening? And again, we are up here because we want to make sure we do it slow but gradual, but we want to give every reason to reopen. So as we test, obviously I would look at the kind of the percentages of that testing. So as we do more widespread testing, clearly we're going to see and catch more positives. We know patients that are positive and don't have symptoms. We know patients are positive and have symptoms. And so we'll be able to catch some of that, especially with the antibody testing. I think that's an important part in our address and approach on this. So we clearly will see the raw numbers go up. We're going to probably have a little bit of yo-yoing back and forth as we test more or we open gradually. You'll see a little bit more, and then let's manage it and bring it down. But my concern as a hospital operator and all of our hospital executives are looking at what's our capacity, and that's what I try to demonstrate early on in the presentation is our capacity and making sure that we don't hit that ceiling and that we operate in this window of when we see these spikes and these yo-yoing of the numbers, that we keep a safe environment and that we don't have to use alternative care sites. We want to protect those beds, but operating in that parameter. From a hospital standpoint, we want to make sure our PPE is good, our staffing's good, our beds are good, our ventilators are good, which you saw today. Dr. Legan had mentioned stabilizing in the numbers, and we're seeing that in our hospitals as well. We don't want, one of the requirements is widespread testing, so we're bringing that to the table, as Marilyn had mentioned. We want to make sure that we're able to do that here in Southern Nevada. And we don't want hospitals to operate in the crisis mode. And right now we're doing good. But again, as I said earlier, our best weapon is the social distancing and the masking, and it's being effective. So that keeps you out of the hospital. So, yeah. Dr. Legan, if you can come up and talk about more of the testing.
Thank you. Okay. I think that's a great question because actually it reflects the complexity of the issue that we are facing right now. Because if you look at the federal guidelines for opening the economy, one of the requirements is to have 14 consecutive days of decrease in the number of cases. So obviously, if we start doing massive testing, which is also one of the ingredients of those requirements, massive testing means that you will identify more cases. So the good news with the massive testing is that really the people that you are testing are either people who are with mild presentation of the disease. So those are people who in the current environment wouldn't have gone to the emergency room or the acute care facilities. And also, you might find positive cases among individuals with no sign or symptoms of the disease, which is very important for us because it tells us what proportion of our community is able to spread the virus and might never be identified. Now, when we start running analysis after this massive testing, we had to discount for the results coming from the community side, because otherwise there is no way to compare the current curve with next week curve. So I guess I answered your question. Okay. Okay, well, thank you. I will start on this. Well, yes, I mentioned the asymptomatic because actually we're talking about having an indicator to open the economy, to have an idea of really what is the spread, the progress of the disease in the community. There is no way you properly know that if you don't test among the people who are without signs or symptoms, because one of the challenges with this disease is that right now we know that between 25 and 50% of people infected do not show signs or symptoms. And actually, last week there was a report from the Navy that they test 4,800 Marines, and 60% of them came out positive, and they were asymptomatic. So that gives you an idea of really what the issue with asymptomatic is.
So what I would tell you is absolutely. We know a lot of people, and I get the calls all the time, that people want to have testing just for peace of mind, to know that maybe they didn't have it, or people that may have come in contact with someone. And testing is important for a lot of different reasons. And until you have the capability to ramp up, as we're showing you here today, we can't give them much except that save it for our most vulnerable that are in crisis mode. And so our goal in what we're seeing around the country is to have that testing available so that we can do a lot of different pieces of it. And as Dr. Lagon said, the research behind it helps us for the very next time, because who's to say that it's not going to come back in the fall and you start all over. But until we have all of that data, we can't make decisions ourselves. But I don't want to have to tell people that, no, you can't go have the testing because I don't have enough, because today I'm showing you that we've been working tirelessly for a few months now to ensure that we do have that for a variety of different reasons. Yes.
Great question. So the question was going back to the really the first slide on our metrics, the number of ventilators, the number of ICU beds, or overall bed capacity or PPE. And the concern was, is if we do have spikes, are we ready? And I feel very confident that we are, because we've done a lot of planning over the last several weeks in regards to our surge plans, managing our PPE, being able to source it, learning much more about this virus and how to treat it. And that's why I kind of laid out some of the treatments that we're doing here in Southern Nevada. So I think we're very confident in being able to handle any spikes, but kind of goes back to make sure that we don't go past that ceiling to where we have to use the alternative care sites. But the nice thing is we've got that all worked out, and care and staffing and logistics all prepared to be able to take care of patients beyond our hospitals here in Southern Nevada. So I feel very confident that we're all working very collaboratively, like Commissioner Kirkpatrick said. Day and night we're working on this, and again, things are ticking in the right direction throughout all of our hospitals. Yeah, we're currently working with all of our supplies, but we also work with the MAC, the county, the state, the feds on sourcing and allocation of all those items. So, but every day, just like the PPE, we're in the yellow, but we have to stay ahead of that. So we're very aggressive to make sure that we don't fall into any categories that we would be concerned. But we're getting very good at this, and just very confident in all of our hospitals here in the Southern Nevada that we're working very well together. We're sharing ideas, collaborating, and the testing is going to be a game changer for us. You have another one more? No, antibody testing is, we're working on that within the next 30 days. So we're ramping up even more capacity. All of us are. You've heard Dr. Legan is ramping up more. But this Friday we'll be up to 1,500 tests by Friday. And then the antibody testing, we're currently working on that. And we'll be able to kind of unveil that over the next 30 days, hopefully sooner than later. But it is important, I think, back to your question on doing the widespread testing to be able to find out who's been exposed, perhaps positive but not symptomatic, so we can be able to identify that population who's built up a little bit of immunity and the antibodies to the COVID-19. Yep, it's called convalescent plasma therapy, and we're looking to do that hopefully within the next 7 to 14 days. Yeah, so that's so the question was regarding the press release in regards to increasing our testing and who are we going to be testing and how do we prioritize that in the community. And Chief Stombeck and Dr. Legan and I and many others will be working on those designated sites. And you know what, Dr. Legan, I may have you come up because I know we're going to prioritize. And we've got some areas in the community that are considered hotspots. So he's going to really advise us and guide us. And then Chief Steinbeck, would you mind coming up and talking a little bit about how we're going to deploy being able to do more community-wide testing? And that's what we're talking about here today. So I'll invite the gentleman up to come up.
Right. Yes. Yeah. What you mentioned is the original, I would say, more restrictive recommendation for testing, and what we're trying to accomplish now is to do testing in order to respond to the question of are we ready to open the economy, which means that we need to know the progression of this disease beyond those who are ill. And that's why among our consideration is including asymptomatic residents who actually could be positive for the disease. And that will help us identify the trend of that disease in our community.
Thank you. John Steinbeck, Fire Chief at Clark County. Yeah, so exactly what Dr. Legan said. So what we do is through emergency management, through the Multi-Agency Coordination Center, is we put the right people in the room to solve the problem. So currently working with the state, certainly working with the health district, with UMC, and the private labs to determine exactly what the best plan will be to be able to optimize that volume of testing. It's one thing to be able to do 10,000 tests. It's another thing to decide who's going to go ahead and get those tests, and then how are you going to go ahead and collect that many tests. It's a logistical issue that we've seen in other states. We're following we are monitoring how that's occurred in other states. We are in contact with other states, and we are currently writing out that plan as we speak. and you'll see that coming out very shortly. Today, I certainly couldn't definitively tell you it's going to be this group or it's going to be that group, because that's the information that we're currently gathering at the same time while this capacity is increasing. So when the capacity was at such a level that there had to be prioritization, even with those that were very sick and in the hospital, that doesn't give you the same ability as it does once you have the capacity now to go beyond that. So that's the strategy that we're currently working on, and to say anything more than that right now would be premature, but I'm not going to ask you to wait very long. We'll have that answer soon.
So the question was relative to contact tracing, the methodology that we're currently utilizing, which we at the Health District utilize all year long for instances of tuberculosis or hepatitis outbreaks in certain hotspots or pockets around the community. So we're using that same methodology or model, and we've just expanded that significantly at the Health District to address. And of course, like I remember the day when the first case came, and then it's just grown over the last 8 weeks. But each one of these positive cases are assigned through epidemiology and contact tracing, individuals that are telephonically reaching out to the contacts. It's really an investigative process. It's very labor intensive, but we have an application that we're utilizing to do text and more of an automated component for keeping in touch. But we also have the human aspect of it, where we have our frontline disease investigators out on the streets. We have individuals making phone calls. We've lateraled some employees, upwards of 2 or 3 dozen from other divisions within the health district where we close down, let's say, immunization. We're not doing active immunizations currently, so we were able to repurpose those folks internally to expand the phone banking aspect of contact tracing. We had a meeting this morning to talk about expanding that even further, because if you expand the volume of testing and you do identify additional positives, which inevitably you will, if you don't have the capacity to trace and monitor those folks and request them to quarantine in place, stay at home, and who they've been in contact with, and it's kind of a partial plan. And so we are scaling up even further the program that we have in place that is very effective. And it is scalable, and we're fortunate to have that aspect in place. So you bet.
I would think that, okay, last question, because we're going to have you back, because you're going to help us roll it out with the general public when we need to ensure that we can get folks. So like you're helping us with the census matters, fill it out. So we're going to have you help us the other way too. Last question.
So the question was, what did we do at UMC to be able to ramp up and do this amount of testing at our facility? So it was really a team effort, lots of support from our county. The governor's COVID task force was heavily involved with Jim Mirren and his team. There were some capital improvements. We converted a outpatient therapy area of the hospital, so a lot of our engineers, our clinicians, our lab team, our supply chain, all work day and night to be able to convert essentially what's a second lab. And we've got already a sophisticated lab at UMC, one of the best in the country, and we've created that and duplicated that to be able to handle specifically COVID tests in this facility on our campus. So really a team effort and great collaboration by everyone.
So, lastly, I want to thank Commissioner Weekly for the foresight of pushing UMC in this direction and really helping us get that testing out there for the long term, because he has been, UMC is his baby, as he would say. So this really was his pushing and working with Mason and his team. So with that, thank you. And we will invite you back in just a very short time to help us roll this out when we have a significant amount of tests to go. So thank you.